Hi, my name is Beenish Kamran, and I am a graduate student studying public health in the Department of Community and Behavioral Health at East Tennessee State University. I will be sharing our research team's study to identify motivators and barriers to recruitment and retention of diabetes prevention programs, or DPPs. So let's first start by talking about diabetes in the United States, specifically type 2 diabetes, which is the most common form. It occurs when the body is unable to properly use insulin, which helps glucose get into the body's cells. Individuals with A1Cs or average blood sugar levels greater than 6.4% are considered diabetic. Those who are older, have family history, or are inactive are at higher risk. While over 30 million people in the US are diabetic, almost 3 times that number are pre-diabetic, meaning their blood sugar levels are not high enough to be diabetic, but higher than what is considered healthy. 1 out of every 3 adults has prediabetes, and what's most shocking is that 90% don't even know they have it. The good news is that there is strong evidence showing that prediabetes is reversible. This is where diabetes prevention programs, or DPPs, come in. These evidence-based, low-cost interventions aim to create lifestyle changes which have actually proven to cut the risk of diabetes by half. These year-long programs are CDC approved, include group support, and are led by a trained lifestyle coach. Individuals in the program work to eat healthier and be more active in order to lose weight and cut their risk of diabetes. The National Institute of Diabetes and Digestive and Kidney Diseases have been conducting a study on the outcomes of this program. When compared to metformin, a generic and effective treatment medication, the DPP has a much greater impact, almost twice as much. Those who have gone through the program have shown a 58% decrease in risk in just 1 year, while those who took metformin only saw a 31% decrease in the same time period. These outcomes of diabetes prevention programs are very promising, and with hundreds of programs all across the country, the risk and rate of diabetes in the US should be decreasing. Unfortunately, this is not the case. This is due to the extremely low recruitment and retention rates of these programs. Studies have shown that only 1 to 5% of individuals who would benefit from a DPP program actually join them. But why is this? Is it a lack of awareness or inconvenience, or a lack of support for these programs? What really motivates and deters individuals from joining wellness programs, and specifically the DPP? In order to improve recruitment and retention rates, we decided to study this further. By partnering with YMCA of Kingsport, our research team brought their CDC-recognized diabetes prevention program to employees working in a building on campus at no cost to them. With 215 employees in the building, it should be expected that almost 75 of them are pre-diabetic, since 1 out of every 3 adults are. Email invites to initial information sessions were sent out to all employees in the building. Out of these, 2 attended the first information session, 2 called in showing interest, and 3 attended the second information session that had to be held due to the low interest. All 7 of these individuals enrolled in the program in September of 2017. This low number matches what has been reported in the literature. So this group was a representative sample for us to understand what's really going on in terms of recruitment. We used a qualitative approach to conduct 3 focus groups, 1 with the current DPP participants and 2 with employees who did not enroll, or non-DPP participants. Incentives were given in the form of university umbrellas and/or food. Questions centered around motivators and barriers to wellness programs, like the DPP. Notes taken during focus groups were coded for themes. So let's start off with our results concerning barriers to participation. There are 5 main themes that emerged. First, since the program is a diabetes prevention program, it is aimed towards those who are on track to diabetes. However, many people are not comfortable facing the pre-diabetic label and the burden that comes with it. This deters them from even going to an information session, which is meant to give more info on the program and determine eligibility. Second, individuals, especially non-DPP participants, shared an interest in knowing more details about the program beforehand in order to gauge whether it meets their interests. Individuals are more receptive to wellness programs that are geared more towards their personal interests. One participant said, "If I was interested in something, I'd be willing to pay." Time commitment was noted as one of the hardest parts of joining and staying in a wellness program. Individuals preferred shorter commitments during the workday, especially since most of them sit all day. Next, many participants faced difficulty exercising due to lack of motivation, a comfortable and convenient location, and activities that help or work around various health concerns of theirs. Finally, a lack of support from families was another major barrier. Having unhealthy food choices at home because a spouse or kids do not want to eat healthy is not a very motivating environment. One participant even shared that her family thought she was weird for trying to eat right. Now, when it comes to what motivates people to join these programs, there are four main themes. First off, individuals in all focus groups showed a desire to be a health advocate. They want to have conversations on how they can take charge of their health and really make those needed lifestyle changes. Coworker support is a motivator almost all individuals saw the importance of. Having this support allows them to build relationships with like-minded individuals, which helps increase accountability and retention in the group-based program. Individuals also want catchier and more personalized advertising, where they know what they're getting into. Whether this is sharing other success stories or advertising yoga for chubby people, recruitment messages for these programs should appeal to the different audiences. And finally, having a family history of diabetes was a huge motivator for several individuals who had witnessed loved ones facing lifelong illnesses, pushing them to make sure the same doesn't happen to them. In conclusion, an emphasis on improving wellness rather than preventing diabetes is key when advertising or sharing this program. This, along with appealing to individualized interests and concerns, will encourage individuals to take more ownership of their health. And finally, support from families and coworkers plays a large role in accountability. Recommendations for all groups involved in DPPs can be made from these results. For individuals implementing these programs, it's important to note how to frame these programs so it is more appealing and encouraging for all individuals to join. For employers bringing these programs to their site, ensuring there is a supportive environment for your employees will increase interest and engagement. For individuals debating whether to join these programs, this is a chance to become an advocate for your health, with support from many levels. Finally, we encourage further larger-scale research in communities facing similar recruitment and retention issues. This will build the limited research that has been done and give us a better understanding on how to tackle barriers and motivate populations to take charge of their health. Due to the national and local shifts towards diabetes prevention programs, studies like this one are especially important to take into consideration. Many insurance plans and even Medicare have started including DPP as a covered benefit. This study is especially significant for Tennessee, since the DPP has recently become a covered benefit under the state insurance. And since all 9 locations that are covered are YMC programs, partnerships with this local organization is especially important. In order to ensure a strong recruitment and retention of these programs across the state and the nation, we need larger-scale research centered on the underlying barriers and motivators to participation. With a strong, intentional recruitment and retention plan, the diabetes prevention program can have a greater impact on not only reducing the risk of diabetes, but improving the health all across the country. Finally, I would like to acknowledge and thank our study team and partners across the college, some of whom are listed, our local YMCA at Kingsport for partnering with us and bringing the DPP to campus, and the Research Development Committee at ETSU, who awarded us the major grant to conduct this study. Thank you for listening. If you have any questions, feel free to reach out to Dr. Deborah Slauson at slauson@etsu.edu.